Hello, and welcome to Making the Cut, the podcast dedicated to everything plastic surgery, health, and wellness. I am your host, Dr. Patrick Basile, board-certified plastic surgeon from Jacksonville Beach, Florida, and I'm joined by my co-host, the amazing and talented nurse practitioner, Hope Gulley.
Woo! Episode 1, here we go.
I know, so it's been a long time coming. We've been thinking about this for a few years, but we finally figured it out and have the time to do it now, so I'm very excited.
Very excited.
So, we're going to have a different topic every week, but I think first one, we're just going to kind of dive right in and say, what's the state of the union in plastic surgery?
Right.
Where are we? Where are we going? And things like this. So, I don't know. What are some of the things you want to go over?
Gosh, I mean, I think current trends would be super interesting to go through, and maybe, common questions we hear from patients too, as far as like different looks people go for, or, we can kind of run through a couple different options, I think. Absolutely.
So, without a doubt, we are seeing more in the last couple of years of weight loss patients. Mm-hmm. And also the trend to get away from the shock and awe of plastic surgery and more about body balance. So what do you think of that?
I think it's been an interesting shift lately in seeing a much more natural look kind of becoming more and more prevalent. So that covers the span of both surgical options as well as, non-surgical, like in aesthetics and injectables, and, a big shift in emphasis on skin health and just wanting more balanced and more natural as opposed to kind of a wham bam experience,
Oh, definitely. The kind of lingo we're hearing now is that ballet body, or that balance thing where you're not seeing people being thrown off and stuff like that.
Yeah.
So we're definitely seeing that in our practice.
Definitely. And I think it's a relief too. It's almost like it's kind of always been our practice's motto and aesthetic as well, as just balance and cohesivity within the body and a patient. So
yeah,
it's finally matching us.
Also, like, smaller implants.
Right.
If we are doing BBLs, smaller volumes.
Yes. Yeah.
Just trying to get that. What about like from the aesthetic side, like in the injectables? What are you seeing?
Yeah, I'm seeing a big shift in, there's a big emphasis now in facial balancing, right? Which is always the point of an injectable. It shouldn't ever be to throw ratios off that are naturally there. But there's been a lot more push from both, how we're trained and different trainings I've been to, where I noticed a big shift in like, okay, we're looking at this more holistically as opposed to, you come in for lips and you get lips, which is really good. So
yeah, and I know we've all seen those lips out there,
oh my goodness,
that overabundance of filler.
It's wild.
And again, I think the other term we're hearing a lot is Ozempic face.
Yes, that's a big challenge.
Yeah, but one of the things I think we're seeing also is that people who are younger and younger are starting to go on these, weight loss regimens, which we'll get to in another episode. But
it's a big topic.
Being younger and having that younger skin,
right?
We're not seeing necessarily the skin laxity, but we're seeing is the loss of volume.
Yeah, and it's how do we restore that volume in a way that's age appropriate, conscientious of how time and everything goes down the line as well. So it's a big conversation, I think, to have with a patient, but that's just what it is it's a conversation, and you set your goal.
Yeah. But I think most people are receptive.
I think so too. I think it's actually been a lot more patients coming and saying, how do I avoid this look, or how do I avoid the overfilled, the just overinflated kind of look, which I think is honestly a relief in my mind as an injector too. Is awesome. Yeah. Let's, always push the natural look.
There's nothing worse than like having to say like to a patient that ain't gonna look good.
Yeah.
And then you're getting a little bit of an argument or something. But
yeah, it's a tough line to walk for sure.
But I think most people again are pretty open to your suggestions.
Yeah.
Especially because we're seeing more and more people who've never had these fillers before.
Right. And I think that's where it comes to when you educate a patient super well and you're like, so this is like the point of a filler and this is the point of like a neuromodulator, like a Botox or Dysport or something. It's when you teach, I think people are a lot more receptive. And then also learning, these are not just things you should be able to walk in and get off the shelf. It takes a lot of training to be able to do it. And you want to do it safely, and especially with the neuromodulators, I'm like, it's a drug. We got to be smart with it. So,
and I think the key word, which you just said there, is safety, right?
Yes, number one.
I tell patients all the time, we both went to school for a very long time and had very focused training in this specialty.
Exactly.
It's not like we're in another specialty and trying to figure out how to do this. This is what we
Right.
trained in. So
Yeah.
safety is important. So check whoever your provider is,
Right.
of what their training is and experience, and also who's leading their program. If you're going to a med spa, make sure that their medical director
Right.
is either a plastic surgeon, ENT, dermatologist, who this is all part of our training.
Totally.
Not another specialty where if there is a complication, they don't
Yeah.
necessarily know how to handle it.
Yeah, or they aren't trained to handle it,
Correct.
is the biggest, I think.
Because I know we've all seen those tragic outcomes where
Right.
we get called and it's just like, we do our best to fix it, but sometimes,
It's heartbreaking.
it's struggling. Yeah.
And it's avoidable at the end of it, which I
Completely.
think is the hardest part of an entire situation like that.
Yeah. I think the other thing is, plastic surgery isn't going away.
No.
Aesthetic and wellness isn't going away. And the numbers, it's just a big growth curve like that.
Definitely.
So with more people entering the space, I think the trend is that there are more people that want to start doing it.
Yeah.
And,
Well, and it's such an interesting field too, but
yeah, but safety, again, I think what you said earlier is without a doubt one of the most important things, because if you don't have safety, you can kind of ruin it for everybody.
yeah. Well, and it opens a door to just, like I said, heartbreak. That's just for you, for a patient, for, what have you. But I think you nailed it when, anytime I speak to a patient, and even if they don't choose to necessarily like go with the plan that I have or what have you, it's like, well, these are the questions, which I hear you do in surgery all the time, is like, we need to teach people that like, just because someone can inject doesn't mean that they should be. So we need to like, always vet who your provider is and who your injector is or your surgeon, and, ask the right questions, which I think is what we're all about.
Yeah, one of the things that, I think is just super important is that the word of education. I tell, and I know you do this very well. You're there to educate your patients.
Right.
And sometimes they'll go along with the plan. Sometimes they won't, or sometimes,
Right, yeah.
but at the very least, they're going to leave with more information they arrived with.
Yes.
And
yeah.
also know what is good and bad, because I think a lot of times what we'll hear when people are in our practice is, no one's ever explained it that way.
Yes.
And
yeah.
if I knew that, I would have done this or differently or something else.
Right. It's just, you have to be fully informed. So I always tell a patient, like, even if you're coming in and you've been getting Botox for 20 years and, we want to talk about it, but the second you sign your name on like an informed consent for a treatment, you have to be informed. And if you haven't, that's my job.
Yeah.
That's a job that I didn't do well. So, and it's interesting because I do have patients who'll come in and they've been doing this for 20 years and they're like, oh, no one ever told me that that's how my frontalis works and this is how this works.
Yeah, or
and,
why we're doing this,
Yes,
or why
yeah.
I can do Botox in one area, not the other, but I can't do it
Yes.
vice versa.
Exactly.
Because you're going to get that. Because, that's the other thing. People will come in and they're like, everybody has a budget, which is fine.
Yeah.
But
Totally.
sometimes that budget doesn't, go along with what would actually look good.
Yes.
And so it's be better off be like, hey, wait a little bit longer till you can kind of get this part of the plan.
Totally.
Rather than just do something.
Right.
Or sometimes it's so underwhelming that they'll feel like they didn't get the value.
Yes.
Of it.
Yeah.
So I think that's important.
I think it's important too. So that's where like, having a fully comprehensive consult, I think is the art of it, which I think we do very well on the aesthetic side and very well on the surgical side too. Cause, I hear you in consults all day where it's time and it's, it's not that we're here to do something right now, this second, but it's that you leave and you have a better idea than when you walked in, and it's teaching.
Sure. And I think, we're all fighting that stigma of plastic surgery.
Yes. Yeah.
That the media likes to, build upon or has in the past.
Right.
Of like fake, weird, all
Yeah.
that other stuff.
Just wonky looking. Yeah.
Yeah, and
Yeah.
and that's not us. We're here for
No.
natural look. The word plastic surgery comes from the Greek plastikos, which means to remodel. And I tell people all the time, the goal is to restore form and function.
Right.
Right. And that has to be our goal. That's at least that's our goal. Our goal is not to
Definitely.
create characters that just don't fit, people can go somewhere else for that. But, it's just, that doesn't kind of jive with what we're doing. No. So it's, it's exciting every day to meet people and start them on this journey and everything, but it all starts with education. So it does. And again, it's not going anywhere. It's like, one of the largest growing industries and also one of the largest growing medical fields. And that's the other thing, I just want to remind people that this is a medical field. Right. It's not just like getting your hair cut or your nails done. You don't just drop in and pick someone willy-nilly. You really want to make sure that, you go to someone that's safe, that uses clean techniques, has good product. Yeah.
Consistent. Absolutely. Like consistent results and, and treats people like people. Oh, totally. I think that's something we like always strive for, that we talk about all the time is, I know that I specifically am super particular with like who does my hair, who does my nails. So like you should be even more particular about who's putting stuff in your face or doing surgery for you. Yeah. So where do you think we're going to be heading in this next year or two? Oh, I think it's super exciting within the field specifically. Anywhere. And plastics. Like, where do you see these trends heading? Like, in the last year or two, like we talked about, balanced body. Right. All the balancing. I think I'm very excited for where our field is heading specifically, because even within medicine, like as a whole, there's a new focus and shift into prevention, right? Which I think that's where a lot of our patients are falling into now when it comes to aesthetics and when it comes to surgical interventions and things. Even just seeing like the age groups that come in, especially for aesthetics and skincare and laser and everything. It's very interesting to see that we're like, okay, I want to get ahead of it. Or I always joke about when I have like a huge influx in like aesthetic patients come in after the holidays, because it's like I spent all this time and I saw Aunt Barbara out there and she's, I want to prevent as much as I can. Oh, yeah. So I think that that's going to be a really nice shift in the aesthetics field is prevention, but that comes into a lot of education and, not wanting to be, we always want to age. Aging is the point, but we can age gracefully and we can do it like very well in a healthy way. And one that's safe. So absolutely. What do you think? I think, everything you said, I think, one of the hot topics is wellness. Yes. Involved with what we do in aesthetics. So exciting. Where we're really trying to optimize beauty from the inside out. Yes. Because you can't do a good focus on beauty on the outside without starting with the body. Exactly. So like, IV hydration, regenerative medicine, focus on just preparing the body for surgery or procedures like this, which is what we do. Yeah. But I think there's going to be more eyes on that. And that's going to become a much kind of more common thing that people kind of go. So I'm absolutely excited for the future. I'm excited for this podcast too to grow. Me too. It's gonna be so fun. So we started this podcast again with this episode of sort of like State of the Union, current trends, future. We are, I think our next episode, we're gonna talk about who we are, and get into that, because I think it's important for everybody to know like who our team is and how we got there and stuff. Definitely. If anyone listening has interests or topics they want to talk about, or even questions, they can email us at info@patrickbasilmd.com. Remember, that's Basil with an E. Yeah. And just put in the subject line, Making the Cut podcast, and any question you have, and we'll be sure to get back to you. But it was very exciting to do this first episode. I know, crazy. And again, long time coming, and we're just still in the midst of building out our studio here, which is very cool. Still haven't named it yet. It's looking really good. But it's coming along. It's nice and cozy. Yes. Yeah. And again, so thank you for joining us, and we look forward to the next episode. Awesome.